Perfect. Okay, I'm going to mute myself, and then if you want to start, all is good.
Thanks, Sarah. So I'm Claire Campling. I'm one of the assistant SEN service managers in the SEN service, and I am responsible for the ages 0 to year 7.
And I'm Jan Bailey, and I'm also assistant service manager in the SEN service, and I'm responsible from year 8 to age 25.
So one of the reasons we wanted to come today was just to give an update, really. We've been a rapidly growing service over a kind of 2-year period. And along that pathway, we've really been wanting to, so all of our staff have been responsible for ages 0 to 25, and obviously that's our statutory responsibility. But more recently, we've looked at reorganising the staff to support hopefully more effective ways of working moving forward. Press the button. There's always the famous bit, isn't it?
They're not changing for you. Easiest thing might be just use your arrow keys.
Okay. Is that doing it now?
That's it, it's worked.
Perfect.
Yay. So why have we looked at reorganising? Actually, it's two things really. One is that it's been a rapidly expanding service. So over the period of time of about 2 years, we've almost doubled in size in terms of the capacity of our staff. And what we've been looking at really is allowing more focus and specialism within the age ranges. So rather than our staff needing to be experts in everything from 0 to 25, which as you can imagine involves a whole range of different processes and specialisms, we've looked at separating that up so that we can focus better on the particular themes of those age ranges. In particular, we wanted to look at that focus between supporting early years transitions and also post 16 and PFA transitions. So ensuring that those are key areas that we're looking at between those age ranges for those staff teams to ensure we're providing a better service in those ages. It's also to give better data on specific areas so we can understand our current and future capacity of needs in the service, because what we find is that in terms of statutory processes and transitions, there is a difference in those age groups. So what we're doing from 0 to year 7 is different to what we'd be doing year 8 to 25. So it's really looking at, if we separate those out, then we can really start to analyse and look at the data, the numbers, the information coming into the service, so that we can really ensure we've got capacity right across those age ranges in terms of staffing to be able to give the best service we can. Equally, obviously, there are different whilst the themes and generally the people involved are similar, we want to improve multi-agency working in all of those pathways. So by separating those ages up and the management structure up, we're really looking at a way to ensure that we're getting better working relationships with the key professionals during at those age ranges. So again, really hoping to improve those multi-agency working partnerships that we have. And as I've already said, it's really about developing more specialist knowledge across the teams so that we can really start to focus and concentrate. So I'll move on to the next slide. Because there's lots of staff, we've separated up the structure up into 3 or 4 different slides, actually, just to give you an idea of what it will look like. And what I do need to say is, because there's lots of information on these slides, it is going to be published on the local offer. So whilst we'll give you these slides, I suspect because they're a picture, when you zoom in, it might get a little bit blurry. So we'll definitely ensure that Sarah has the link to local offer so that you can then be able to sort of look at the structures more closely. So this is I've shortened it just to the 0 to 11 team, just because we're trying to keep titles quite simple. But 0 to year 7 is essentially what my teams are working at. And on this slide, you can see that there's me as the assistant service manager. So I'm operationally responsible for these teams. and that there are 3 area team managers. So that's Melissa Philby, Pippa Demant and Ziggy Redstall. And then they are responsible for special needs officers who then manage smaller teams geographically across the county of caseworkers. Now, there are different numbers of caseworkers in different teams, and that's based on the number of cases, essentially. So what we're looking at is ensuring that for our caseworkers, they're not working on any more than 250 cases each. So that's why you'll see there's variability, as it were, across those in terms of number of caseworkers. We also have some caseworkers that work part-time. So again, it's ensuring that we're making that up to a full-time equivalent. So that's the structure. And as I say, it's myself, it's area team managers, 3 of those. And we've got our special needs officers on the next layer down. And then on the bottom layer is all of our caseworkers. And then Dan?
So this is the 12 to 25 team, which is clear if you say year 8 to age 25. So very, very similar to how Claire has described for her side of the service, works in the same way. So obviously there's me with responsibility for this area, and then 3 area team managers, as with Claire's side. So I've got Jan Reed, Tracy McKenna and Jen Greensmith, who are my 3 area team managers. And then you'll see below the 3 of them, there will be the special needs officers, exactly the same as Claire has described for her side. And then there's the caseworkers. All works in exactly the same way in terms of the areas do vary in terms of the size of the area and the numbers of young people that we have in those areas. So therefore the caseworker numbers are slightly different, just so that we have enough capacity in those areas to meet the need there.
Oh, that's gone off the screen a bit, which is not very helpful for me, but I think it's just because I've got the chat bar along the top. So we do have 2 other areas within our service that aren't operational teams. So the first of those is our development team, and that's run by an assistant SEN Service manager called Alistair Hines. Now, the development team are responsible for a few different areas. Alistair is directly responsible for a range of different projects that are running in the service. So that would be things like the Education, Health and Care Plan digital hub. He's responsible for the implementation of that and the continual development of that. So he has that as a specific project, and also ensuring that all the relevant parties are involved in that digital hub. He's also responsible for the line management of the help desk team. So you can see in there that there's a long list of staff that are working on supporting the help desk. And so equally, as part of that development, he is looking at the telephony systems involved in that surface, and moving that on to be an improvement pathway. So we're absolutely clear that it's an area that needs continual review, development, and particularly in terms of the system. So right now we're using a team system for the help desk, and that was part of the rapid handover we needed to do as part of with COVID and working from home. But we're just in the process of engaging with the ITs and telephony people who are experts in this to develop that system. So again, that's another key project that he's involved with. We have data analysis, so we've got information and data analysis, and that's the 2 positions that are there. So particularly looking at, obviously, drilling down on all of the data and improving, working with us as ops teams to look at how we can improve on that. And then we also have an administration team, so they're predominantly responsible for sort of financing, the paying to schools, the paying to various providers we're using, that sort of stuff. So that's the development team. And then finally, we also have a small tribunal team. So Predominantly, tribunals are managed by operational teams. So if there is a case where we've not been able to resolve locally, or we can't offer the school that the parent would like, or there is disagreement for any reason, and a parent is offered a right of appeal, then that work continues to remain within the case teams. However, we do have a sort of a small administrative section, which is our tribunal team, and Anna Harper is the assistant SEN service manager responsible for tribunal and complaints. So she has an overarching sort of strategic management of tribunals in the service, and the administrative team are responsible for key contacts with the tribunal and also bundles and things like that. So the legal paperwork that is required for this. So it's a small team, but just to be really clear, operationally, tribunals do remain with caseworkers and with teams. So they continue, because obviously they're most knowledgeable on the child or young person that they're working with. And so this team really are only responsible for the administration, training, development, and holding of those cases as Anna is the senior lead in that. So that is the SEN service right now. And if I just move to the last slide, in terms of next steps, what we're looking at is launching this reorganisation after half term. And as I said at the beginning of the presentation, this will be found in the local office, so anybody can click on it and find that information. We are on a continuing pathway of recruitment, and part of that, which you'll see in the structures, we do recruit agency staff, certainly to fill gaps if we're struggling to recruit. Recruitment across Hampshire is a huge issue, both in all areas, actually. I was going to say education and local authority, but in all areas. So we have rolling recruitment programs at all levels within our service to ensure that we are filling the vacancies available. But more than that, we're constantly in a place of analysing the performance of the teams and capacity in the teams to look at increasing capacity. So those are two continual pieces of work that we're doing as a service and feeding back at higher levels, because almost in terms of the number of requests we get in each month for education, health and care needs plans, we could recruit a caseworker every month in order to cover those numbers. So it really is, whilst this is the set number at the moment, we are constantly looking at that and feeding that back through the right mechanisms to look at additional funding to increase capacity in the service. The other key element, obviously, that we're looking at is focusing on training and development of our current workforce. So whilst that's always been a fundamental part of what we're doing, due to the size of the service now, we're running a specific project, and that falls under the development team, of how we can improve and make that training and development better, more effective, and also, as we described at the beginning of this, to ensure that it's more focused. So whilst there are obviously statutory themes that run throughout the whole of that age range that we need to make sure we get right, there will also be focused pieces of trainings for those specific age groups to ensure that we're developing their skill set and specialism. Is there anything I've missed, Jan? I've rambled on a lot, haven't I?
No, you've covered everything, I'm sure.
Okay, Coat. So Sarah, I guess I'll go back to you then, just in terms of any questions.
Yeah, just close down that slide for me, because then everybody isn't kind of, if people are watching on phones and so on, then we're sort of thumbnail size at the moment. Perfect.
Oh, yeah.
Okay, so one question I've got at the moment, well, two actually, but one that's come in just now. If somebody has a named caseworker and that person is now in a different age bracket to their child, what will happen?
What we're doing is looking at gentle and gradual handover. So essentially what we've been doing is working together. So relevant caseworkers will be working together with their managers at handover at this point. So if there is a complex piece of work that's currently sort of underway in the process of just finalising, then for those caseworkers, so for example, if there is just in the process of amending or finalising a plan, or in the tribunal framework, then essentially we are, the caseworkers are holding on to that piece of work until a natural completion, if that makes sense. So in many cases, that's what we're doing. If there is going to be a shift and a move, then we've been doing it for some time in terms of that general kind of working together to ensure a smooth transition. But over the half term, that will be the point at which we're looking at those final handovers. So if there's a complex piece of work that we're in the middle of, they will be completing that piece of complex sort of casework, and then a gradual handover.
And how will parent carers know who the new caseworker is?
So the caseworker will be introducing themselves as part of that phase, or introducing the next person if they're completing that phase. Okay.
I think you did mention this, but could you clarify how many cases you hope, or you aim objectively for each caseworker to be handling?
Aiming for 250. Well, at the moment we have a funding bracket. I say it in a different way. We have funding for there to be approximately 250 cases per caseworker. Now, part of what I talked about in terms of next steps is us really analysing what that means for those age ranges. What does that look like? So that's our working number at the moment, is 250 cases per caseworker. But whether we need to reduce that is a constant conversation that we're looking at, and we're really constantly looking at the data and analysing that to explore that further. So, for example, if you think about the 0 to 11 age range, or 0 to year 7 age range, actually about 70% of our new requests come in those age ranges. So you can understand there would be a different focus on statutory new assessments with that age range. However, with the older age range, obviously there's potential for there to be many more transitions between different educational environments, and also that key focus of the young person, where they want to be, the shifts and changes that they're going to have over that time, what their aspirations are. So that annual review and amendments and phase transfers, again, becomes much more of a statutory piece of work. Jan, is there anything you wanted to add there?
No, just as you said, really. That's I think you've kind of covered that, really.
Do the number of people with EHCPs currently split evenly between those two age ranges? Because my thought is, based on when EHCPs came in and the age range went to 25, that you've currently perhaps not got that many in that age bracket, but more and more are going to filter up.
Actually, I think in terms of timescale, we're almost at the point now.
It's almost there. Yeah. I mean, it is slightly tipped towards the older, you're right, but they're not far behind.
No. So pretty even across both sides, which is one of the reasons we've looked at doing it in this way. I think also what's important to just differentiate is that for those in the younger age, essentially when we're looking at total caseload, that includes both those that are maintained and those that are in the assessment process. So of those 250 cases, for one case worker in the younger age range, it would be that they'd have many more assessment, pupils that are under assessment in that age range, whereas in the older age range, they'd have more that were maintained. Does that make sense? But overall, the number of cases would be the same.
Okay. I've got this is a comment rather than a question, so I'm going to read it to you because I think it's just where somebody is with something. There isn't really a question here. As a parent who is meant to be on your side to get the right placement for your child, we are in year 5. My daughter has an EHCP and the transition process is coming up again. Not sure I understand the process. I feel like I'm getting different stories. However, it feels like it's me, mum, fighting all angles. There's not a question there, but I just want to read that to you because I think it's sometimes important to see, and I know you guys come to a lot of our things, but to see where parents are. And to that parent, I would say there have been lots of SEN clinics that we've done on things like transition and the process and going through it step by step. They are available via our YouTube channels. Please do use them. I will also put the link up for SEN because they can hold your hand through that process. Because the transition process does feel, having been through it myself fairly recently, it is a big deal. It is a big deal. But it should only be one process. So you shouldn't be getting different stories. but yes, do lots of people on the call will have been there with you, so you're not alone. So do reach out, do go along to the HPCN get-togethers, because there will be people there who have been there before you and can just reassure you that you're doing the right thing. But yeah, I as a parent myself, it's tough. It's not an easy process to go through. Okay, I've got another question, which I think
I don't know, Sarah, if it's worth just mentioning, but that is one of the key reasons that we're looking at these, essentially focusing on those age ranges, so that we can, give a better service to parents and schools and professionals in terms of there are key elements, so that actually, obviously we deal with at the younger age, we'll be dealing at those that have an EHC plan before school and are transitioning into school between infant and junior, and from year 6 to 7. So for us, it's about being able to focus on that being those are our key transition points, and so therefore we can do better in terms of our communication with parents and schools moving forward. I mean, a key point with the year 5 people would absolutely be about the annual review in the summer term. So I'm hoping that is in train with the school.
I think that point's important across all the ages,
Absolutely,
isn't it, Claire,
yeah.
Really? And another reason we've done this, which was touched on during the structure, is to improve our multi-agency working with the relevant agencies for our age group, and hopefully that will also improve the service that we provide.
Something else you talked about was specialisms, and a question's come in that I think looks into that, because I think you talked about trying to improve knowledge of specialisms within particular teams. So somebody said, would you be putting like cases together? For example, will there be caseworkers who specialise in dyslexia, ADHD, etc.?
No, we won't be doing that. So the cases are distributed according to age range and geographical location, but we link caseworkers to schools, if that makes sense. So there are and that's broadly speaking how they're linked to their local area. They're distributed, for example, in the Winchester and Eastleigh team, but they'll have a patch of schools that they're responsible for, and the children and young people that attend those schools, colleges, range of education providers is how they're distributed. However, obviously, if one of my schools has a resource provision for children with specific learning difficulties, dyslexia, dyspraxia, obviously that will then be an area that we'll be working together to develop and understand that further. The same with our special schools and other resource provisions. The key thing for us is about developing relationships with the key professionals involved in that. So it will be really about, that teacher in charge of that resource provision, or the specialist, teacher advisors, or whatever it is that. So it's about, so in that way, they will develop that over time, but otherwise, no, they're broadly responsible for that age range and that geographical area linked to their sort of feeder schools, as it were.
I'm just thinking, so they'll develop that specialism where somebody is looking after a school that has a specialist element, won't they? But if you have a diagnosis, and the one that I have come up with off the top of my head, you won't be surprised to hear, Claire, is Down syndrome, where potentially you've got children in lots of different settings. So it's less likely that somebody will deal with more than one person with that diagnosis, I presume.
Yeah.
Yeah, possibly.
Okay.
But in fairness, what I should say is it's not the caseworker's role to be a specialist in a certain area. Their role is to run a statutory process and to contact the key professionals that are the experts to get the advice and information. Do you know what I mean? So that is why we wouldn't have a specialist caseworker in one specific area.
Another good question linking to what you were saying is how does it work in terms of caseworkers if your child is in a different county? So is a Hampshire child but placed in a school outside of county?
So they would be linked to, so essentially the caseworker would be allocated based on the home address and where their catchment school would be, if that makes sense. So even if you're attending that school in another area, actually, if my local school is this, then the caseworker that would be linked to the local school would be the caseworker. So we link it to home address and the catchment school that they would be attending, were they not in the one across the border or independent or whatever.
Okay, one which I think you and I sort of talked about before we came on, but I just want to go through so that we've cleared it up. we talked about whether it was an SEN restructure or an SEN reorganisation, and I've been asked, can you ask about how the service users, parents and carers participated in the design of the restructure? How were service users' feedback sought and used to ensure that the restructure meets the needs of the service users?
So this wasn't a restructure. Actually, a restructure happened in the service some time ago. We are under a new service manager and inclusion lead who identified that we needed additional management capacity and additional staffing. And that's been a process we've been working on over the last year and a half, I guess. So we already had a process where caseworkers were generally working in that way, but we felt that actually they weren't getting the direct management specialism that we needed. So actually this has been about improving the management layers and reinforcing what was already a strand of what we were trying to work on, if that makes sense. So it's ensuring that the caseworkers that have historically been working in the older age ranges, we're being very much clearer on, they're holding those cases in a very clear way, and they're getting the management support throughout the layers and structure to ensure that they're getting the right input and support to do the best they can with those cases.
I've been asked if they can have people can have the presentation as a PDF because they couldn't see the detail, which I mean, I'm on a laptop and I struggle to see the detail. I think yes, you said it's going on the local offer.
Yes, definitely, but it is a picture. And so actually the local offer link, which I'll put in here, will be the one that you can zoom in really easily, because I suspect if you zoom in on these, I don't as the PDF, it may not give you the detail you need, but it will be on the local offer. And
is it going on the local offer? Because you said this was launching after half term. Will it go on the local offer after half term?
So it should go on at the end of the half-term holidays, but we've got a bit of bank holiday stuff going on there. Yes. But yeah, it should be ready for just after half-term. Yeah.
Following on from what we've just said previously, will you be collecting parent-carer feedback on an ongoing basis to improve the service?
So this is an ongoing piece of work, and actually as part of Alistair's development role, alongside working with all of us really. So obviously we do tie in with the HPCN network on a regular basis and gain feedback through that forum, but we are looking at ways of getting more input and looking at how we can be more interactive with that. So it is one of our themes of development under Alistair.
I've just been asked, and so I'm just looking for the link to the local offer. Claire and Jan will have heard me say lots of times before that one of my frustrations as a parent is it's really hard to find something on Google if you don't know what you're looking for. So I will put the link on here for local offer, which is a bizarre title for what is effectively a website with a vast amount of information on about what is offered in Hampshire. But it is a statutory title, isn't it, I think, because it's actually something that is required in the legislation, which is why it's not called something much more helpful. And it's called something which is, not remotely obvious. So I have put the link for the local offer there. And I know the local offer is also something that is being worked on by the Hampshire team at the moment to make it slightly more user-friendly, because there is so much data on there that even when you know you're in the right place, it's sometimes quite hard to find what you're looking for. So that's on there. Likewise, in terms of what's available, our get-togethers are a great place to come along, and you will always find that somebody knows something that you don't know, and I'm learning after 12 years of being a parent of a child with special education needs. There's constantly things I'm finding out that I didn't know, so do come along. Right, I have no more questions for you ladies at this time. If somebody suddenly comes up with a burning question whilst Bex is talking to us, you can of course pop it in the chat and we will pop it in. Thank you very much, ladies. Bex, hello.
Hi. I have just removed my towel from my background because it blended into it, so I was sort of one big dark blur. So I'm a bit clearer now.
You do really weird things, like sort of you can start yeah. Anyway,
very strange, isn't it? But yeah, thank you. Thanks for having me today. So my name's Bex Guy. I am the Deputy Designated Clinical Officer and Service Development Manager for Special Educational Needs across Hampshire and the Isle of Wight. And I work for the Hampshire, Southampton and Isle of Wight CCG. I wanted to just come on here today to talk to you about two of my priorities that I'm currently working on. Unfortunately, unlike Claire and Jan, I don't have a pretty presentation, so you'll just have to listen to my voice for the next few minutes.
That's okay.
I do apologise. So I want to talk to you about the multidisciplinary team panel that we are looking to set up across Hampshire for autism referrals for children and young people. So at the moment, we have piloted this MDT panel, which stands for multidisciplinary team, on the Isle of Wight, and it has been incredibly successful. So I'll give you a bit of a run through of what the panel does. We on the Isle of Wight have an admin team provided by the Wellbeing Service who collate all of the autism referrals, which can be sent in from any healthcare, education or social care professional. At the moment, they cannot accept self-referrals for autism assessments. So all of those referrals are sent into a central mailbox, and they are collated by the admin team. And we have a panel that attends bi-weekly meetings, and they are made up of all sorts of different people. We've got people from support services, we have sometimes educational psychologists, we have people from the incumbent provider of the autism assessments being SECON. I chair the panel. We have health visitors. We have all sorts of people that attend these panels, people from Bernardo Support Services, Isle of Wight Youth Trust, mental health support teams. So we can really drill down into each individual case that we're presented with on that panel. We look at about 25 referrals bi-weekly, so we look at 50 a month, and each case is discussed individually. We look at the holistic needs of the child in the referral and all of the evidence presented. We also have members of Isle of Wight Therapy, which is fantastic. Their knowledge is brilliant and fantastic to have them on team. We discuss each case as a whole, and we make a decision whether we think it is appropriate to be sent on to SECON for an autism assessment, for them to triage and carry out the assessment. What we also do, which was the whole aim of this panel, is to signpost to additional support services at the same time. So we're not able to directly refer, because that will be looking at whole different pathways and creating new pathways, which in an ideal world, that would be the dream. We just don't have the capacity at the moment in the CCG or within the additional support services to set up those pathways. But that is a goal, that is a future goal where we'll get to. So what we do is, if we see an assessment come through for a child with autism traits, but are also have traits of suffering with their mental health or anxiety, or parental mental health or parental anxiety within the evidence, we are then able to signpost on to any additional services that we know of available in the area, so on the island in this instance, to be able to provide support and straight away for that family or that child and young person, rather than it just going to SECON, going for an assessment, and no other contact is made with the family. So the original referral will get correspondence direct from the admin team for the panel, explaining whether they have been successful in passing the criteria to be sent to SECON for an assessment, and they will also be sent the information. So they'll be sent in that one letter, either some links to any referral forms or links to any support websites, or any other advice that we feel necessary as a multidisciplinary team to help support that. The aim of this is to make sure that there aren't any closed doors, that even if it is deemed that it's not appropriate to go forward for an autism assessment, that support is offered there and then. Because of the success of the Isle of Wight panel, we are trying to implement it in an area of Hampshire at the moment. There are initial discussions going on, and we're drawing up a membership list and flying around some terms of references between the members that have identified they are willing to sit on this panel. So it's still very early stages, but the dream is to get these panels across the whole of Hampshire. So we're initially looking to set this up in North East Hampshire at the moment, with the aim to go live with the first panel in September. So we'll tie in nicely with the new academic year. I'm sure, as you can appreciate, it takes time to set these things up. We need to change referral pathways, we need to change referral forms, we need to make sure that the communications are out there to the right people to ensure that people are aware of this change rather than it just being pounced on them. It takes a while to get through systems, especially with the GPs getting the right referral forms linked up to their systems to make sure that it is as clear and as correct as possible to stop any grey areas. We appreciate the list, the waiting times for autism assessments is incredibly long, and we're hoping that this is going to really help. We've seen an improvement on the island in the pilot, which is why we're very, very keen to try and implement this across Hampshire. At the moment, it's all going well, and I'm like a swan behind the scenes. I'm trying to cope with it up here, but my little legs underneath are paddling away, trying to get this in motion as soon as possible. And we really feel that it will be of benefit to everybody. It will offer support services straight away, whether the answer is yes or no to an autism assessment, in the hope that it will ease problems that families and children and young people are facing at the moment. My other priority at the moment is specialist parenting support across Hampshire and the Isle of Wight.
Bex, can I pop a couple of questions in on that bit first?
Yes, please. Yeah.
Before we move on. So, comment, that sounds absolutely great for autism. What about other forms of neurodiversity? Okay,
so at the moment it is only for autism. We are looking at a neurodiversity multidisciplinary structure. We are looking at the whole thing as a holistic approach. We're working really closely with the other areas of the ICS, so Portsmouth and Southampton as well, and the Isle of Wight, to see what we can do to improve that, because we do recognise that is an area that does need additional support and time.
Yeah, funnily enough, as I've asked the question, I've had another, and it's a comment popped up. The Ofsted review 2 years ago specifically flagged a need for neurodiversity assessments, not just autism.
Yeah, that is something that we are looking at as a CCG and working holistically with our other colleagues.
And then the other comment on that area for you was, are girls being diagnosed, they mask and are often missed?
Oh, we are seeing a 50-50 split at the moment. So it seems to be that has been noted. The awareness and the education of autism has increased tenfold, and it has become apparent that that is a trait in girls. So people are now looking out for that. People are aware of that. And it does seem that has now leveled out, and we aren't seeing that as a problem anymore.
The question is just put, that's good to hear. So, I mean, it's certainly feedback of a certain age that we see, but perhaps if we can sort it out from the bottom, it'll be sorted earlier. Okay, I just wanted to slot those ones in while we were on topic.
Thanks, Sarah. Yeah, so my other priority at the moment is specialist parenting support across Hampshire and the Isle of Wight for autism and ADHD. So at the moment, it's currently provided by Barnardo's. Their contract is due to expire at the end of March 2023. So some people on here may be aware that I've been looking at a service review for this service. I created collaboratively with Hampshire Parent Carer Network and other forums a questionnaire to go out to past service users, current service users, and people that are just aware of the service that may not have actually gone through the service themselves, just to get some really rich feedback to see what word is on the ground, because that is the important message that we need to be listening to when we're recommissioning these services. We had a really good uptake of the questionnaire. We had some suggestions of some tweaks to some questions, but which I did compile all of those concerns, and it seems that actually I managed to get a really good response without needing to go back out with that questionnaire, but I was fully prepared to do that, but I didn't need it. We have had some really good feedback. I've spoken to lots of different professionals that link in with the service. I've looked at the pathways, I've looked at the acceptance criteria, and I've got some really good information. I'm now working with my commissioning colleagues to look at the service specs, because the Hampshire and the Isle of Wight were originally commissioned on different contracts. So we're now looking to combine those contracts and have one service across the area, so across Hampshire and the Isle of Wight. Barnardo's have actually been in post for this contract since 2016. And as you can appreciate, especially over the last 2 years, a lot has changed in the need, the demand, the deliverance of this service. So it does need to be looked at. It does need to be reviewed, and it's come at a perfect time. I'm very interested to see how this is going to pan out and to look at the appetite across the area and to see what other additional services are aware of this and would be interested in looking into the procurement with us. And I just want to thank everybody that's on here that may have looked at the questionnaire and have submitted responses, because it has been so valuable. I will, of course, keep everybody up to date with how the procurement's going, and hopefully we'll have a really good substantial service come April the 1st, 2023. I welcome any questions on anything that I've discussed today.
Brilliant, Bex. Thank you very much. Not had one on this bit yet, but you never know, it's always possible. So thanks guys for joining us, because we know it's a busy time, so we really do appreciate you taking the time to come along and explain things to us. Just flicking through my diary to see what's coming up after half term. So we have got our next parent-led engagement session on Tuesday the 14th of June. That's an opportunity to come along and talk to members of the SEN team about perhaps something where you feel that you've got a blockage in moving forward for your young people. Ideally, if you can give us a heads up that you're coming along and give us some background information in advance, then it really helps Jan and Claire to actually do something worthwhile for you on that call. Jan and Claire, I don't know if you want to add anything at that point and say what, because those calls are, we really see some people where we can really help move things forward. But it really helps the guys if they could just look into something a little bit in advance. We've then got our next Meet the SEN session. Oh, crikey, where am I going to? I can't even find it in my diary, ladies and gentlemen. So at some point, we've got all, I put the link up for all of HPCN's future events. Like I say, it's our get-togethers are a great opportunity to come together with other parents. They are increasingly going back face to face after what is nearly 2.5 years of being on Zoom. We appreciate that is exactly what some people want, and some people totally want to stay on Zoom, because some of you are joining us from home, with young people at home with you. Some of you are joining, from the office. So we are also going to be putting on 2 Hampshire wide get-togethers on Zoom once a month. One will be a daytime one and one will be an evening one. So we really hope that there is a provision for everybody, whether you want to come face to face, whether you want to come and log on Zoom, so that you have that opportunity to come along and just sort of share where you are really, and get a little bit of perhaps moral support. And just tell us what's going well for you, and perhaps what your frustrations are. They're really, really good events, and it's so nice just to know that you're not the only one doing it. Okay, I've got no other questions come through. Bex, Claire, Jan, anybody got a final word? No worries if you haven't. No, Bex is happy, Claire's happy, Jan's happy. Good, excellent. Thank you very much, ladies, for your time. Thank you very much to all of you who have joined us. We will put the recording up at some point, and as soon as that link is up on the local offer, we will be sure to find it and share it with you. Thank you very much, ladies. Have a good rest of the day, and those of you who have a half term, please enjoy it. Take care. Bye-bye.
Thanks, Sarah.
Bye, everybody. Thank you.
Thanks, bye.
Hello, Sarah. Just want to say a quick hello.
Hi, Emma. How are you?
I'm joining you from the school, so sorry I had